As we all know, the testing policies have changed and Niagara Health is adapting to them. Here to talk about that, we have Derek McNally for our weekly visit. Derek, we don't need a referral now to be tested for the virus. How has that changed things for your assessment centers?
Good morning, Mike. So, as you know, the Premier announced last week that he was encouraging individuals to come forward, that they didn't need an appointment. And so for us at Niagara Health, switched our policies and our practices around. Our numbers were actually going down in our assessment centres. So since this policy was put into place, our numbers have actually doubled from what they were. So the policy went into place on Friday. We had a few people who were walk-ins, if I can call them that, Mike, on the weekends. And then there was a larger number on Monday and a larger number of people looking for referral. And so actually we're seeing around 140. Monday we saw 372 patients through our 2 assessment centres. And so the numbers are climbing. We expected that would happen, and we're ready for it.
At 372 this past Monday, is that the capacity, the full capacity in a single day, or can you actually assess more than that?
Mike, we can assess more than that. We're currently open 8 hours a day, 7 days a week, and we have a plan to ramp up to 10 hours a day, 7 days a week, and then 12 hours a day, 7 days a week if required. So we have additional teams ready to step in if we have to increase capacity.
As we know now, we do not need a referral from a doctor, but you're still recommending that an appointment is made ahead of time. Why is that important?
I'll just walk you through the process. If you show up, which you're entitled to do, then you'll be asked to stay in your car, and then you'll have someone from our registration staff call you in your car to register you on our system. And then once that registration is completed, then you'll be asked to stay in your car until the clinical team calls you. Your file will then be sent to the clinical team, who will then call you to come. If you come with an appointment, you basically arrive. You're seen by the security guard at the entranceway to our assessment centres, and you go straight through, whether you're told to either to go to the drive-through or in to see our team for an appointment.
The people who have not pre-registered, phoned ahead for an appointment, how long on average would it take for them to be seen at the assessment center?
From start to finish, it could be anywhere from 30 minutes to 60 minutes.
So it is significantly longer than those people who do have an appointment. What kind of information is collected at registration?
So it's just general demographic information. Your name, date of birth, address, next of kin, and of course you need to have your health card with you, because that's your sort of identifier for us. So just the general demographic data that we would collect for any registration, whether it be for this, an admission to hospital, and emergency department registration.
Derek, are you expecting that we will see a significant increase in the numbers of positive testing results based on the volume of people coming in now for testing?
Well, that's a great question, Mike, and that's what we don't know, and that's what we're actually trying to find out. If we do have folks in the community who are not symptomatic but could potentially be positive, and then there's the whole follow-up to that and the whole tracing and tracking and monitoring of that.
And of course, we'd like to remind our viewers that if they do go for an assessment, whether they've made the appointment or they're planning to wait, they should make sure that they bring a mask, because you still have the mask policy in effect. Has there been much pushback about the mask policy?
No, actually, you know what? I have to say that the community has been very respectful. There are a couple of instances where we've had to look at our policy just in regards to patient condition, but we always do that, whether it be for masking or any other area that we have to examine as we go through this time.
Perfect. Thanks for your time today, Derek. Thanks for the information. And again, a reminder to our viewers, if you do plan to go for an assessment, always best to phone ahead to make that appointment. Thanks again, Derek.
Thank you. Have a great day.